I would say that this is one of the most major studies that has come out in the last 10 years that people are unaware of, including our primary care and other practitioners, and other providers. Yeah, Dr. Washburn, what would you say to a PCP colleague who says, what's the ACE studies?
The diabetes you think you're treating, you're not treating diabetes. You're really treating an upstream issue that is adverse childhood experiences. We now know this, research has qualified this, that when we have trauma in childhood, it can have a wide range of issues downstream, especially in adulthood: asthma, cancer, diabetes, chronic pain. We actually know this, that these stressors, these lesions, they create an overactive nervous system. And that is actually what helps to develop these chronic physical illnesses. That even though with diabetes management, education is really important. Working with blood sugar, working with diet, that's really important. But if you really want to get the most bang for your buck, it's really helping your patients come to understand that there's a connection between trauma and health-wise what's going on in their body in this moment.
And so I think you were using that diabetic as a metaphor, that if we don't address lifestyle changes, the bigger problems, blood sugars, things like that, it's like putting a bandage on a diabetic ulcer and saying you're done. With chronic pain, the adverse childhood experiences needs to be at least aware that these happen in our chronic pain populations. They're more prevalent than our general population, and that we need to start to apply tools to help manage this, and that we're not going to really make huge gains in treating chronic pain or helping our patients manage chronic pain if we don't address the bigger issue upstream.
Pills, procedures, injections, scans do not touch trauma. We're not really treating chronic pain if we don't look at the trauma piece.
Yeah.
Yes, and it comes with a lot of psychoeducation. We like to think that once we educate our patients, they grab onto this idea and they go with it. Sometimes it's really working with them, just constantly informing them about this relationship, doing this, educating them in different ways about this, having them go to our mindful movement classes. Things start to click down the road, and it takes some time with some of our patients, but eventually it does click with them.
We also find mostly that once patients are able to hear that there is a connection between things that has happened, that they've carried it with them within their body all these years, and that it wasn't their fault, we find that that's really when the healing begins. Patients are relieved to know this information. That's been mostly our experience, than more of the resistant. People tend to blame themselves for having chronic pain, and we want our patients to know that this is just another disease. Your brain, like you'd mentioned, has kind of rewired itself based on early childhood. But there's hope, and there's tools that you can learn to manage your pain, unwire some of this. We have this metaphor, like it's almost as if you are walking down a well-paved road. There's no more bushes. You've gone through that road several times. The path is completely clear, and we're asking you to suddenly shift through and take a different route, which has a lot of weeds and bushes, and you have to trample through it. But over time, with practice, you'll see that road too will become a well-paved, smooth road.
In the other path, those other behaviors that were not productive, that grows over.
So that's kind of our metaphor for we have a lot that we try to use with our patients to try to get them to understand all the complexities of treating not only just chronic pain, but trauma as well.